Hi everybody, and welcome to another episode with the Anxious Resistance. Today I'm going to be talking about something really interesting and something that I actually found a long time ago when I was really struggling with my anxiety, and it's something called Phenibut. Now, this is something that I've never actually tried. Again, I'll go into why it's maybe sometimes dangerous and not necessarily a good thing to use, but it's out there and it is an effective anxiety treatment. So let's hop into it. Phenibut is a synthetic chemical compound that belongs to the class of gamma aminobutyric acid analogs, GABA analogs. So this is similar to the medications that we already have on the market, known as gabapentin and Lyrica, also known by its generic name of pregabalin. GABA is a naturally occurring neurotransmitter in the brain that regulates neuronal activity and has an inhibitory effect on the central nervous system. Phenibut is structurally similar to GABA, but with an additional phenyl ring attached to it. This modification allows Phenibut to cross the blood-brain barrier more easily and bind to specific GABA receptors in the brain. Phenibut was first developed in the Soviet Union in the 1960s as a potential treatment for various psychiatric disorders such as anxiety, insomnia, depression, and post-traumatic stress disorder. It was also used by cosmonauts to reduce stress and enhance performance during space missions. Phenibut is still prescribed in Russia and some neighboring countries under brand names such as Unveiling, Phenibut, and Nuelink. Again, I'm not Russian, so I'm not sure I said those right. However, it is not approved by the Food and Drug Administration in the United States or by the European Medicines Agency in the European Union. Instead, it is sold online as a dietary supplement or a nootropic. A nootropic, again, is a substance that claims to improve cognitive function, and it is sold online by various vendors. Phenibut is available in many forms such as tablets, capsules, powders, or liquid. When I've done my research into Phenibut, most of the time what I've seen is powdered. The most common forms are Phenibut hydrochloride and Phenibut free amino acid. The HCl form is more water soluble and faster acting than the free amino acid form, but it is also more acidic and may cause more gastrointestinal irritation. The free amino acid form is less soluble but more bioavailable than the hydrochloride form, meaning that it will have a longer duration of action and require a lower dose. So how exactly does Phenibut work and how does it help with anxiety? Phenibut exerts its effects mainly by modulating the activity of GABA receptors in the brain. GABA receptors are divided into two subtypes, GABA A and GABA B. GABA A receptors are responsible for most of the fast inhibitory actions of GABA in the central nervous system, while GABA B receptors are involved in slower and more prolonged inhibitory effects. Phenibut has a higher affinity for GABA B receptors than for GABA A receptors, meaning that it binds more strongly and selectively to the former. By activating GABA B receptors, Phenibut reduces neuronal excitability and induces relaxation, sedation, and anxiolysis, which means the reduction of anxiety. Phenibut may also have some effects on other neurotransmitter systems in the brain, such as dopamine, serotonin, and glutamate, all of which have been tied to depression and anxiety type symptoms. Glutamate's a little bit newer, but some theorize that that's how ketamine works to treat depression and anxiety, is by inhibiting the AMDA receptor, which is a glutamate receptor. So again, all of these have potential roles in depression and anxiety treatment. Dopamine is a neurotransmitter that mediates reward, motivation, pleasure, and mood. Serotonin is a neurotransmitter that regulates mood, sleep, appetite, and cognition. Glutamate is a neurotransmitter that modulates excitatory signals in the central nervous system and is involved in learning and memory. Phenibut may increase dopamine levels by inhibiting its reuptake or breakdown by stimulating its release from certain neurons. Phenibut may also increase serotonin levels by enhancing its synthesis or release by blocking its reuptake or degradation. Phenibut may decrease glutamate levels by inhibiting its release or by blocking its receptors. These effects may contribute to phenibut's mood stabilizing, antidepressant, cognitive enhancing, and neuroprotective properties. Evidence for use. So, Phenibut's use for anxiety comes mainly from animal studies and human trials conducted in Russia and other former Soviet countries. These studies have shown that Phenibut can reduce anxiety-like behaviors in rodents exposed to various stressors or models of anxiety disorders. Phenibut has also been shown to improve subjective measures of anxiety, mood, sleep quality, and cognitive function in healthy volunteers or patients with various psychiatric conditions such as generalized anxiety disorder, social anxiety disorder, PTSD, obsessive compulsive disorder, alcohol dependence, or insomnia. However, these studies have several limitations such as small sample sizes, lack of placebo or active control groups, short duration of treatment, inconsistent dosing regimens, and poor reporting of methods and results. Therefore, the quality and reliability of the evidence for Phenibut's use for anxiety is low and should be interpreted with caution. Moreover, there is a lack of studies on Phenibut's use for anxiety in Western countries or in accordance with the current standards of clinical research. Therefore, more rigorous and independent trials are needed to confirm its efficacy and safety. So in my experience, I actually have heard some subjective experiences of people who have taken Phenibut and have found it beneficial for treating their anxiety symptoms. So this lack of Western studies is a limitation only because it makes it less standard, less approved, less accessible in those countries. And again, I think a lot of that is because companies are now not going to put research into Phenibut because there's no money that they can have out of it. Maybe they can learn something from its mechanism of action and create another drug that is similar to it, such as Lyrica or gabapentin. But doing this research on their own is not going to create any profit for them, so it's going to be left as this unregulated supplement. So that is my take on it. I think it can be effective. I think some people take it and it's effective, but there are some limitations, and you do need to be very careful about how you use this. Make sure you do deep research, even talk to your doctor before you use it. The optimal dose of Phenibut for anxiety depends on several factors, such as the form of Phenibut, the severity and type of anxiety, the individual, body weight, metabolism, tolerance, and sensitivity to Phenibut, and the presence of other medications or substances. There is no official or standardized dosing guideline for Phenibut, but based on available literature and anecdotal reports, the typical dose range for anxiety is between 250 and 1500 milligrams per day, divided into 2 or 3 doses. The FAA, or free amino acid form, may require a lower dose than the hydrochloride form due to its higher bioavailability. So keep that in mind. And the onset of action of Phenibut may vary from 30 minutes to 4 hours after ingestion, depending on the form, dose, and route of administration. The duration of action may last from 4 to 10 hours or longer, depending on the dose and individual factors. Phenibut should be taken on an empty stomach, or at least 2 hours before or after a meal to maximize its absorption and effect. Phenibut should not be taken more than 2 or 3 times per week, or for longer than 4 weeks without a break to avoid tolerance, dependence, or withdrawal. This is the biggest limitation with Phenibut use. It is a short-term treatment. It is going to lead to quick tolerance and dependence and may have some withdrawal symptoms. So Phenibut should be started at a lower dose and gradually increased until the desired effect is achieved or the maximum dose is reached. Phenibut should be tapered off slowly and gradually when discontinuing to prevent rebound or withdrawal symptoms. Okay, so what are the side effects or contraindications of Phenibut use? Phenibut is generally well tolerated at low to moderate doses and may cause only mild and transient side effects such as drowsiness, dizziness, headache, nausea, stomach upset, fatigue, or irritability. However, at high doses or with chronic use, Phenibut may cause more serious and potentially life-threatening side effects such as impaired coordination, memory loss, confusion, psychosis, seizures, respiratory distress, coma, or even death. Okay, so again, especially when taken with alcohol or other drugs that affect the GABA receptors such as benzodiazepines, some antidepressants, anticonvulsants, and other nootropics, you have to be so careful with Phenibut. So again, if you're drinking, if you're using any of those medications I just mentioned, this is probably not for you, but it is worth knowing about and worth being educated on. So these interactions may enhance or antagonize the effects of Phenibut or the other substances and increase the risk of adverse reactions or overdose. Phenibut may also cause tolerance, dependence, or withdrawal with repeated or prolonged use. Tolerance means that higher doses are needed to achieve the same effect as before. Dependence means the body becomes accustomed to the presence of Phenibut and relies on it for normal functioning. Withdrawal means that unpleasant physical or psychological symptoms occur when Phenibut is reduced or stopped abruptly. The symptoms of Phenibut withdrawal may include anxiety, insomnia, depression, agitation, tremors, sweating, nausea, vomiting, muscle spasms, or seizures. The severity and duration of Phenibut withdrawal may depend on the dose, frequency, and duration of use, as well as individual factors. Phenibut withdrawal can be dangerous and should be managed under medical supervision. So coming off of Phenibut is similar to alcohol withdrawal. This can be deadly. You are affecting a lot of the same similar receptors in the brain as alcohol consumption does. So you need to be very careful with this, and that's one of the severe limitations of this. Phenibut is similar to alcohol use in a sense. So those who have a potential for substance abuse or addiction, who have liver or kidney disease, who are pregnant or breastfeeding, or who are under 18 years old should not use Phenibut, should be very cautious when using it. Phenibut should be used with caution in people who have a history of psychiatric disorders, who have epilepsy or other seizure disorders, who have cardiopulmonary disease, who have diabetes or other metabolic disorders, or who are taking any medications that may interact with Phenibut. So again, there's a lot of drawbacks to this. I think Phenibut has less side effects and is effective, but long-term use is just really not very reasonable. So what are the positives or pros of Phenibut? It does have some potential benefits and uses. Phenibut can reduce anxiety levels and improve mood in various situations. Phenibut can enhance cognitive function and performance in tasks that require attention. Phenibut can improve sleep quality and duration by inducing relaxation. Phenibut can increase sociability and confidence by reducing social inhibition. Again, that's kind of similar to alcohol a little bit. Phenibut can provide neuroprotective by reducing oxidative stress and inflammation in the brain. Phenibut can be purchased online without a prescription in some countries. What are the negatives or drawbacks to Phenibut use? Some of these drawbacks and risks are Phenibut can cause serious and potentially fatal side effects at high doses or with chronic use. Phenibut can interact with other substances that affect the CNS and increase the risk of adverse reactions, which I have talked about previously in the video. Phenibut does have tolerance and dependency issues and may have withdrawal after prolonged use. Phenibut is not regulated by the FDA or the EMA and may contain impurities, contaminants, or adulterants. Phenibut is illegal or controlled in some countries and may have legal consequences for possession or use. In conclusion, Phenibut is a synthetic GABA analog that has been used for decades in some countries as a prescription drug for anxiety and other psychiatric disorders, but is also sold online as a dietary supplement or a nootropic. Phenibut has some potential benefits for anxiety, such as reducing anxiety levels, improving mood, enhancing cognitive function, improving sleep quality, increasing sociability, and providing neuroprotection. However, Phenibut also has some potential drawbacks, such as causing severe side effects, interacting with other substances, causing tolerance, dependence, or withdrawal, being unregulated and potentially unsafe, and being illegal or controlled in some countries. Therefore, Phenibut should be used with caution and under medical supervision for anxiety or any other purpose. More research is needed to confirm Phenibut's efficacy and safety for anxiety and to compare it with other treatments. Thank you guys so much for watching this video. I will include the sources I used in the full article that will be linked in the description. If you guys enjoyed this video, if you learned something, please like it, subscribe to our channel for more content just like this. We cover all things mental health. Our goal is to inspire you, empower you to take control of your own mental health and live your best, most productive life possible. Thank you guys so much for watching, and I will see you next time with The Anxious Resistance.